Hey there, I'm Jackie Ferris. This week on the 302, a one-on-one with Delaware Lieutenant Governor Kyle Evans-Gay, talking about all of the issues the government is working on for you. Get your pencils out. You're going to be doing a lot of writing. The 302 is headed your way. Welcome to the Office of the Lieutenant Governor of Delaware. We are joined by the Lieutenant Governor to talk a little bit about some initiatives that are important here in the state. Lieutenant Governor Kyle Evans-Gay, thank you so much for joining us.
Thank you for having me. This is great.
So one of the big initiatives that the state is going through right now is the Behavioral Health Consortium. Talk to me a little bit about, for our viewers at home who maybe aren't familiar with the consortium, give me an overview.
Absolutely. So started under our last administration, the Behavioral Health Consortium is a group of individuals who are dedicated to advancing behavioral health awareness and making sure resources are available to everyone in Delaware. As you may know, we have really a hot spot, unfortunately, for substance use disorder and overdoses here in Delaware. Now, I'm really excited to share that our overdose rate decreased by over 30% last year, and we can keep progress moving, but in order to do that, we need groups like the Behavioral Health Consortium who are coming together to share ideas and best practices and making sure they're available statewide.
So when we talk about a significant reduction, like 30%, it's due to, I think, to the education and the work that public health officials have been doing. So what kinds of things are we talking about, just getting out in the streets and talking to people who are, ground zero, who are in the midst of addiction, or what kinds of efforts?
It's that, it's yes and, right? It's being on the ground with individuals, making sure our community partners are empowered as well, because we share constituents, and so making sure they can have access to state resources to then get into the community on the ground. It's also education. I want to give a lot of congratulations and thanks to our public health department. They have regular updates, including information about new dangers in drugs that they see on the street. And that information has been instrumental in making sure that individuals are aware and can protect themselves as well. We also are making sure that Narcan is available throughout the state. And then, of course, like you said, education. I have 2 young kids in elementary school. We need to make sure that our children and our young adults understand how to keep themselves safe in all respects. So as soon as we can, when they're in middle school, we want to make sure that children understand how to keep themselves safe as well.
When you talk about the educating kids and resources and everything, I know that in the past, two of the biggest issues has been fentanyl and then xylazine just kind of infiltrating the community. And I know that xylazine test strips have been a powerful weapon, but I understand there's a new drug, medetomidine, that's come onto the scene.
Yes, and so what the example that you're sharing just opens our eyes to how much we need to be both ahead of the game as much as we can and flexible and nimble so that we can react to what's there. The legislature, as many people know, I did come from the Senate, we passed some bills related to those test strips. But what we need to do is continue to stay on our toes and make sure we're partnering with DPH, who is, like I said, doing those excellent awareness campaigns about new drug additives like medetomidine.
So what are you hearing from the public health officials? What's happening on the ground? We've seen this decrease, but what else do we need to do in order to bring it down another 30%?
It's going to be everything that we're doing, and we always need to keep vigilant. I want to especially highlight the Prescription Opioid Distribution Commission under the leadership of Joanna Champney and our Attorney General, who have revamped their granting system so that we can make sure that granting of these critical opioid distribution funds gets into the communities and with the organizations and individuals who are going to make those impacts at the very local level. It also means partnering with our local municipalities and making sure that they are empowered to tackle the challenges that they are seeing at a hyper-local level. So I really think it's the state plus our critical partners working together to make sure that people are safe.
Now, a very important piece to the mental health framework are our veterans who serve in places and they see things and they go through things that many of us can't even imagine. Then they come home and maybe they don't have the skills to kind of cope. I mean, and this is not something that's just like fresh. This can go on for decades and decades.
Yeah, and I would say a couple things I'd like to point out there in ways that the state can continue to serve those individuals who have served us and have put their lives on the line for our safety and our freedom. One is that the Behavioral Health Consortium, we are expanding to reach specifically a first responders and a veterans community, a subcommittee run by first responders and veterans who can speak specifically to the needs of those communities and can speak to those individuals in ways that are accessible and sensitive to everything that their life experience has put in front of them. Mm-hmm. And so I'm really excited that we have that added focus. We're also, and we can talk about this, we're going to be focusing on communities of care and on maternal mental health as well. But let me just focus on the veteran community because there's another piece that my office has instituted that I'm really proud of that I think reflects both respect and care for this community that they deserve. We have been speaking regularly to veteran leaders across the state to ensure that both information from the government, the state government, can get to them, that they can get to communities, but also so that their needs and their concerns and the issues their constituents are facing on a day-to-day basis are funneled back into the work that we are doing on the policy side, on the funding and budget side. So that kind of communication and intentional partnership is, I think, part of the solution where we start to see our government, our state government, reflecting what our veteran community would like to see in a better way.
Now, you mentioned the maternal mental health.
Yeah.
What exactly is that? I'm sure a lot of moms out there will be like, their ears perked up.
Oh, 100%. And unfortunately, we do have a maternal health crisis in Delaware. And what many people think about is prenatal care concerns and then delivery concerns. And what we want people to realize is that we are actually losing also a lot of moms in the first 6 months of their child's life. Perinatal mood and anxiety disorders go underreported and underdiagnosed, and many people don't know that these same conditions can affect any member of the family, really, who are welcoming a new child into the home. And so what we want to do is make sure that we can help moms by identifying the concern and referring them to the care that they need, because we should not be losing those moms in that first 6 months of their children's lives. And so we're going to be working within the Behavioral Health Consortium, another new subcommittee, so that we can, again, get individuals focused on maternal care and making sure that we are arming our professionals in the communities, professionals like pediatricians, who might see a new mom and say, how are you feeling today? And would you maybe like to speak to someone who could help you talk about some of the challenges you're facing? I've been a new mom before. It's a hard time regardless. We need to show families the support that they deserve as well.
Excellent. And this is just one of many important topics that we're going to talk about when we return.
I'm Alexandra Deutsch, and I work at Winterthur, and what I love about the 302 is that it celebrates so joyfully what happens in the cultural landscape in Delaware and beyond.
Welcome back. We're sitting down with Delaware Lieutenant Governor Kyle Evans-Gay to talk about issues facing Delaware and what our public officials are doing to kind of like address these issues. Now, one of the things that I think is really interesting, and I think our viewers are going to think this is interesting as well, food is medicine. That's a unique concept.
It really is. But what I'm excited about is that it's a proven model, and that we have data from other states that supports the work that we can do to both lower healthcare costs and increase better health outcomes for individuals. So I'm excited to launch the Food as Medicine subcommittee of the Food and Farm Policy Council, and work with partners in the community who have already been doing this work, but we're going to take it to the next level.
So we've been hearing, about the food pyramid and, broccoli instead of French fries. So how is this different in terms of the education piece of it?
Well, don't get me wrong, we still need to eat our broccoli and our carrots every day. I have to remind my 6-year-old of that often. But food as medicine is really a clinical approach to nutrition. It looks at how we can use the right makeup of a diet in order not just to for example, keep weight down, which we know can reduce negative health outcomes, but also to really serve an individual for their unique health challenges, for say heart disease or diabetes. We can make sure that they are receiving a complement of nutrition that specifically goes to tackling their chronic diseases. And as many people know, chronic disease management is not only difficult for an individual and for a family, but it's costly for the state and society as well. And so by investing in nutrition, supporting farms, which we can talk a little bit about, but by investing in nutrition, we can make sure that we are helping people live healthier, longer lives, and hopefully reduce some of the medical interventions that they currently need.
So when you talk about investing, I know when you go to the grocery store, a lot of times the healthier foods are expensive.
They are.
So a lot of people, they go for the processed or they go for the fast foods because it's cheaper and it gets cheaper every day. So how do you tackle that? Is it a prescription for broccoli or?
Exactly right. Food is medicine, and so we are working from a prescription type model where whether you're in the hospital or you're receiving ongoing care, perhaps you're on Medicaid or another carrier that will provide coverage, and so we're going to be working with individuals in the health ecosystem, hospitals, insurance providers, individuals who are receiving care, so that we can make sure that we integrate nutrition, and in doing so, educate and increase access. It's one thing for you to go to the doctor. They say that your heart needs some help and you should eat more apples and broccoli every day. It's another, like you say, to access that and pay for it. And so what we want to do is we want to invest in good nutrition that we know will be beneficial, and like I said, decrease the costs of some of those larger and more risky interventions down the road.
So what role, you had mentioned local farms.
Yes.
So what role does local farmers, do they play in Food as Medicine?
Well, I'm so pleased to have local farmers represented on the committee, as well as restaurateurs and other people who are intricately involved in our food ecosystem. And what we can do with this type of funding and investment is we can help local farmers diversify their crops. We can create local markets for fresh produce. We can make sure that we are investing in Delaware's local economy, at the same time recognizing the real power and importance of one of our top industries, which is agriculture. So here in Delaware, where we have high health needs and we have a booming agricultural market, this is just an opportunity for us to do more and help more people at the same time.
So whenever you say find new markets, I know that in cities that are densely populated, there are a lot of food deserts. You see like Dollar Generals go in where grocery stores go out. So would it be, like a farmer's market, in, Center City, Wilmington, that kind of thing, or?
I think farmers markets are a piece of the puzzle, absolutely. And I want to give great credit to my former colleague in the Senate, Senator Darius Brown, who has done tremendous work on identifying and figuring out ways that we can address these food deserts. But in addition to that, think about something like our hospital systems. If our hospital systems who are purchasing food for large numbers of individuals, feeding people in the hospitals, if they're doing it on a program and prioritizing local produce, that's a massive market for our local farmers. And so creating those local connections means that we're reducing our environmental impact and increasing that diversity opportunity for local farmers, while feeding people food that is going to make them healthier.
Mm-hmm. And also changing a mindset.
Oh, absolutely.
I think, healthier over what's easier.
Absolutely. And we can help by making it a little easier. And we can help by educating people as they are, coming into the doctor's office, where we're doing a lot of education and help anyway. I'm a big believer in that we should streamline services. I'm a big believer in the state, works for the people. And the Food is Medicine Committee is just really excited to get going on what we know is a data-proven method for keeping people healthier and reducing costs.
So when we talk about data, we're talking about California, right? North Carolina.
Massachusetts has a great model as well, yep. And so we are looking at those states as an example, but here's the great part. Delaware is so small that we have the opportunity really to implement a statewide model, and we could be one of the first to do that. So I'm really excited to see what we can do, because when we know that we invest statewide, that means that resources go to people regardless of their zip code, and we have a focus on reaching as many people with the good news that we can.
That's fantastic. Yeah. We'll have to check back whenever we come to see you at the beginning of the year. And we have so much more to talk about when we return.
I'm Jonathan Square. I work at Parsons School of Design, and I love sharing African American history on the 302.
Welcome back. We're talking about issues facing the folks in Delaware. Now, we've talked about health, and one important piece to it is making sure that the people who need these services in the in the hospitals and things like that, that there are people there to take care of them. And so Delaware has this huge workforce initiative. Tell us about that.
Well, I'm really excited that the governor recently announced a redesign of the Workforce Development Council. He's going to streamline it and make sure that it is laser focused on the work that we need here in order to get Delawareans back to work. Our former governor used to mention the statistic that is really surprising to a lot of people, that at any point in time over the past 3 years, there have been more people or more jobs open, I should say, than people looking for work in Delaware, right? And so we know that we need to get Delawareans back into the workforce in order to fuel our local economy. You mentioned healthcare, especially in Sussex County. We have so many new residents. Many of them are over 55, and yet we have a lack of primary care or specialty care. We even see a lack of care, especially western Sussex County as opposed to eastern Sussex County. So from my perspective, we need to do everything we can to recruit professionals, to train professionals, and to invest in programs like the CNA or nurse's associate's degree or bachelor's degree, so that we can make sure that our people here in Delaware are well cared for.
I think one of the things whenever it comes to, filling some of those jobs is that someone will go and they'll become a CNA and they'll stop there. They'll think, okay, well, this is all that I can do. And I think really like the investment that you're talking about to say, okay, there's a CNA. What if she becomes an LPN or an RN, or, just kind of like empowering people to, really grow with the state.
Yeah, and you've hit it right on the nose, because there's a wonderful model that I'm excited about, run out of Delaware State University. It's the ECIC, the Early Childhood Innovation Center. It was funded by ARPA dollars, and it's now up and running. In fact, I came from the opening this morning. And what I'm really excited about there is that they understand that trajectory and the ways that you can encourage people to continue to seek credentials that will make them even better at the work that they are able to do, expand their reach, and allow them to be mentors for others. So the CNA in nursing, it's a Child Development Associate, CDA, in early education. And we see individuals getting scholarships and incentives so that they can be the CDA, move to their associates, move to their bachelor's degree. They even have a couple who have done a master's program. And what that does, like I said, is just make sure the workforce has the right type of workers that we need to meet the needs of our, whether it's older Delawareans or our younger Delawareans. But it also means that those individuals can be invested in a career and they can have a pathway. Those things are really important. we want to get Delawareans back to work, but it's not just jobs. It's providing them careers and opportunities to succeed. It's economic empowerment, and it means that we can do better by more people.
Now, you mentioned early childhood education. You have a teacher shortage, is that right?
That's right, we do. And so I've mentioned, I have two young kids. When I ran for office, one of them was about 7 months, and the other was, almost 2. And I'm sorry, almost 3. My math is wrong. Don't blame the teachers. But what I saw when I decided to run for office was that families with young children like mine were really struggling. Not only did they have a mortgage to pay, but they likely had student loans, and they were paying more than their mortgage in many cases for childcare. And so to meet this need, we really need to make sure we have the educators who will go into these classrooms and make sure kids are cared for, safe, trauma-free environments. And so I'm really invested, and have been for a long time, in making sure childcare works for kids, for parents, and for educators. And when we invest in the workforce, we know that we can invest in educators, and they will be doing great work that will make all of it more accessible and hopefully more affordable for kids and families.
Because it all kind of trickles down. Because if
Absolutely.
you empower someone to learn to become a teacher, to invest in themselves, that knowledge will trickle down to children. And early childhood education, what do they say? The first 5 years of a child's life, their brain is like a sponge.
It really is. And we have so much opportunity to do so much good by these young children. And if we can put educators around them who know the best practices, but are also not stressed and overwhelmed themselves, so they can be their best for the kids, then we will be doing, like I said, the best by everyone. It's an ecosystem of care. And I'm going to make sure that we are, like I said, investing in that workforce, but investing in those workers too. And I'm really excited to see where we go with this. It's been a huge focus of mine, and I'm so glad now, serving the full state instead of a Senate district, that I can continue to elevate this need and make sure that we improve early education in our state.
So if someone wants to know more, they're like, you know what, I've got a CNA, or I want to get a CNA, I want to become a teacher. Where can they find out more information about this initiative?
Well, I think they can reach out to, if in the early ed space, they can reach out to the ECIC at Delaware State University, which serves all of our universities actually in the state through the programming. And I would also encourage anyone to check in with the Department of Labor, some of our workforce initiatives. I cannot say enough that our state government is here to work for the people. We work for you. And so no matter your zip code or your income, find out where we can help you and reach out to us to make sure that we know the best way to do that.
Fantastic. Lieutenant Governor Gay. Kyle,
Yeah,
thank you so much for spending time with us.
I really appreciate it.
Excellent. We'll be right back. Are you enjoying our one-on-one? Well, if you come to the state capitol here in Dover, make sure you snap a couple of pictures and share it with us on Facebook. Now, here are some other things you might want to check out. For more information on any of the things that we spoke about, all you have to do is go to ltgov.delaware.gov. That'll do it for this week's episode of the 302. Make sure you follow us on Facebook to get behind-the-scenes content you're just not going to get anywhere else. We're going to leave you now with some beauty shots of the state capitol. Until next time, I'm Jackie Ferris. Tell them you saw it on the 302.